Osafo, CEO of Medical's Hospital, is back. Hey, dog, what's up? How are you?
Hi, Kwame.
Nice.
Lexus
good.
Bill. Thank you. You're looking fine yourself.
Thank you so much. Yeah, I have a good doctor. That's why. TMZ had this section on their blog many years back, right? They will put a picture of somebody from back in the day and then a recent picture of them, and then they will ask good genes or good docs.
Oh, okay.
So
good docs.
I just got good docs,
That's good. Kwame, yes, it's good to be here another Wednesday, and good afternoon to all our listeners.
Right. Last week, we continued our conversation on men's health. You did expatiate a lot, and today we thought that all the many questions that we received would definitely go through them so that you can try and answer the questions that people were asking from last week.
Absolutely.
And today as well. I know a lot of men out there have questions about the things that we're talking about, PME and ED and all those conditions that really bother
sexual dysfunction.
Yes, that bother men and women.
And women, the stakeholders. Key stakeholders.
So listen, if you're listening in right now and you have any questions, oh goodness, I'm choking.
Oh, sorry.
Yeah. Let me sip some water.
Yeah, let me sip some water. And from last week, we've been having this conversation about sexual dysfunction under men's health. So we're going to continue the conversation. Lots of people. My phone has been ringing non-stop.
I can imagine it.
And it is an issue, and we are more than happy to spend as much time so that we can address it. It's not an easy conversation to have.
Yeah.
Not an ruin relationships. There can be accusations and counter accusations. You're getting it somewhere. That is why when you come, you don't want to spend time. So it's it can be very, very murky. And Kwame, I've seen a couple of people at the clinic, and when you delve into it, you realize that there is a lot. We involve the clinical psychologist and so many other people. So today we're hoping that we can field as many questions, take as many messages, and try and find solutions for everybody.
All right. If you're listening now and you have any question on men's health, the phone lines are activated. 0302-216-541. Or you can send us a WhatsApp message on 055-1111-997. Okay? And if you missed out on any of the past two episodes about men's health, like Doc rightly said, we were talking about sexual dysfunction. We're talking about premature ejaculation, right? We've touched a bit on erectile dysfunction as well,
right?
And all its associated challenges. Now, last week as well, I think we had a question that brought in diabetes,
right?
And I think you spoke to it, but Collins in the UK is asking why is it that diabetic patients suffer weakness in bed? You broached the topic a little bit, but maybe you can do a recap of that question as well.
Right. Thank you, Kwame. And then once we talk about sexual dysfunction, particularly premature ejaculation, I did mention that there are some medical conditions that predispose individuals to premature ejaculation. When it comes to diabetes, then both conditions that fall under the sexual dysfunction umbrella can happen under diabetes. The erectile dysfunction, which is the inability to attain and sustain an erection, as well as the PME, can both occur. And diabetes does this by causing vascular problems, because the whole erectile process involves both blood flow and then also nerve function. And diabetes does damage to both of these two tissues. Diabetes destroys blood vessels, and then also it damages nerves. So Kwame, for example, the peripheral nerves, the one around your feet, I've seen individuals who step on nails, pierces them, and they don't actually feel a lot of pain, because the nerves are dead. But when it comes to that whole penile erection, you need blood to flow into the spongy tissues of the man's penis and stay there for as long as the sexual excitement happens, and then only for the blood to be let go or drained away during orgasm or phase 3 of the sexual response cycle. And then there is a period where the individual sort of like recovers and then before they can go again. So diabetes as a disease would cause damage to these blood vessels. They become leaky and therefore they cannot hold blood. And then also the nerve that supplies that area, that excites all these tissues and initiates all of this, is also damaged. So that is how diabetes leads to both erectile dysfunction and premature ejaculation.
And Efo Kofi Intema is also asking whether diabetic patients can solve this ED problem with medication.
Absolutely. So the target, and everybody who comes to the clinic, I explain this to them. We don't tackle the ED directly. We tackle it indirectly. We tackle the diabetes. And we're going to ensure that the diabetes is under firm control. Kwame, we always say that at the time we diagnose individuals with diabetes, they would have had the disease for many years, 3-4 years prior to the time we actually diagnose. So a lot of the cellular changes, or what we call the microvascular changes, things that are happening at the cellular level that you cannot see, would have started long ago. Those small changes that happen at the cell level would have begun long ago. So let's say last year a doctor diagnosed you with diabetes. It doesn't mean the disease started last year. That was when we diagnosed you. The disease actually started at the cellular level many, many years ago. So we try and tackle the disease diabetes, and in so doing, we try and reverse some of the changes or prevent further deterioration of those blood vessels. So that is going to be how your doctor would approach that. Then, after you've made significant progress, probably we'll throw in 1 or 2 things, to try and help you. But as they say,
right.
You don't stand in a trail of army.
You don't stand in Accra and remove Accra.
Debbie,
we're talking crying. Hey,
in cranny.
Crying.
So you're not going to stand in that problem and deal with the problem. So we tackle the problem, first.
Okay.
One thing about diabetes is that there's always something we call secondary high blood cholesterol. Almost everybody who is diabetic tends to have a problem with managing blood cholesterol levels. And when you have high blood cholesterol levels, again, you do damage to your blood vessels. And these same blood vessels that are responsible for erectile function. And when that happens, then you are going to have those challenges as well. So your doctor is going to look at that and make sure that your blood cholesterol levels are where they are supposed to be. It's going to make sure that your glucose control is where it ought to be so that you don't do nerve damage. And by doing so, we hope to improve your or correct the erectile dysfunction.
All right. The number to call is 0302-216-541. Doctor is here to address all your concerns. You can also send us a WhatsApp message on 055-1111-997. Lisa from Old Ashongman has a question. Very interesting one.
Sure.
She says, thanks for the informative discussion. So if I understand clearly, what you're saying is PME stands for the short period it takes for a man to ejaculate, right?
1 minute club.
Yeah. How would you call it then when the man takes forever to ejaculate? No, it's Lisa.
Lisa.
I mean, I thought Lisa would be celebrating this condition.
Exactly. Because this is a
this calls for celebration.
This calls for celebration.
Lisa has posed it as a problem. She said that is also a problem on its own, right? Can Doctor throw more light? Lisa, on behalf of all men, it is not.
Kwame, I concur.
It is not. On behalf of all men, it is not.
It is not.
Kwa?
Definitely.
Stop.
Well, Kwame, as for this problem, we welcome it.
We were.
Lisa, we don't. I think I mentioned it the first time that there isn't a standard time for sexual intercourse to last. There isn't that. There is no standardized time for how long it should last. All we say is that both parties should be happy. It takes two to tango,
Right.
And both parties should enjoy it. So it would appear that either it's too long, it means it's not pleasurable. So even 2 minutes may be too long if the whole thing is not pleasurable. So this is a couple that obviously need some sex counseling.
Okay, good. I think we've got a friend here. Hello.
Hello, Leslie.
Yes, sir. Welcome.
Yeah, thank you very much.
What's your name, please?
I'm just Christian, please.
Okay, Chrissy, can you turn on the volume on your set? Okay, I get a lot of feedback from your back.
That's okay, please.
Yes, it's better. Let's hear you.
Yes, I had a disease for close to, I think, 22 years or so. And then now I think it has reached a toxicity level to the extent of where I'm experiencing burning sensation all over my body, my feet, very severe burning sensation, my fingers. And then, for the past 15 years now, I can afford to sleep for 2 hours, the whole day. So I don't really know. And I think it has also, as a result of that, I'm also experiencing, I think, blood pressure. So I don't know. I'm 48 years. And then, people have been telling me, that I'm mature, I have to marry. I don't have a kid. So I want to know from the doctor if there's a way forward. I mean, at this age, it would be possible for me to have a child, at least one child. I mean, that could, because it also affected my impairment. At the moment, I'm blind, so I don't really know if there is hope, but I wish if I could have maybe a child or two. And then it's kind of like a very severe irritated dysfunction. It's not moving at all. For the past 15 years now, I've not had erection. So, and it is, I don't know, it's kind of like, sometimes I feel I'm taking out my life, because I'm blind at the same time. My precious weapon is also not functioning. It's kind of like, very worried, very disturbing. So I don't know if doctor can help me, I don't know.
Right.
Okay. Thank you so much, Chrissy.
Right. Thank you, Kwesi, for calling in. And it's a mixed match of issues there. I had ED. I also had hypertension. I had sleep problems. And he seems very down. Yes,
his sight as well.
I mean, he has visual impairment. And overall, Kwame, I sense somebody with a very, very low mood. I don't want to use the word depression, but Kwesi, I would be grateful if you could reach out after the show. We really need to sit and really need to explore. But yes, a lot of the issues are connected from all that he's describing. For men, fertility is usually not age restricted as you have for women. There are a lot of men who are about 50 who have children, but you wouldn't have women who are about 50 who have children. So all those fears can be addressed, but we will need more than just 2-minute response on radio for that. So I just say that at the end of the show, I'll let them. I'll drop the number and then he should reach out. But please hang in there. Let's reach out together with the team at Medicus Clinical Psychology. We are all there to be able to help.
I was going to say that part is also very needed because he says sometimes that he feels like, Charlie, it's not worth it.
Absolutely.
Because if you're listening to us, there's hope, and I'm sure the team at Medicus can be there for you. So don't be down.
Don't despair.
Okay.
Yeah.
Thank you. 0302216541. You could also give us a call or send us a WhatsApp message on 055 1111997. Lexus, please ask Dr. Osafo, what's the role of the prostate in this PME?
Right. So, when it comes to the PME, we wouldn't say there is a direct role played by the prostate in there. I mean, the prostate, its primary function is to contribute to the fluid that carries spermatozoa or sperms from the man into the woman, or as part of the ejaculate, that fluid that comes out, the prostate organ contributes to that fluid volume, and that fluid nourishes the spermatozoa, make sure that those cells are healthy and alive and able to do that function. Anytime people have prostate enlargement, tend to get a lot of urinary symptoms, rather. And then also, if it so happens that the prostate has cancer cells in there, then it becomes a totally different situation altogether. But an benign enlarged prostate would give the individual urinary symptoms. They strain to urinate and all of that. But directly, we do not think that it causes premature ejaculation.
All right, thank you. Hello. Hello.
Hello, good afternoon.
Yes, sir. Good afternoon. How are you?
Fine.
All right. What's your name?
Please, I am a 72-year-old man. And then about 4 years ago, I was operated on the prostate. Since then, I'm not able to function well in bed.
Right. Kwame, is that it?
Hello?
Yeah, we're listening. Go ahead. Do you have any more to add?
I'm not able to function, and then sleepless nights. That's all I have.
Okay, thank you, sir.
Right. So, Kwame, sex is to be enjoyed, and most of the time, I hear people, or I see people take this attitude and say, "Oh, but you are above 60. What are you thinking about sex for?" But when we are too young, we are young too, and we think about it too. The accusation is that you are too young, instead of focusing on your books. So Kwame, so sex is supposed to be enjoyed all the way through to the grave. So we don't take that approach that you are old, so take it like that. So obviously he's 72. Nothing should stand in his way from having a fulfilling sexual life even at that age.
Okay.
Prostatectomy, which is prostate surgery, yes, sometimes has been reported to have, some people then tend to have erectile dysfunction in the immediate weeks following prostate surgery, if I put it that way. Most people tend to recover their performance with time after the surgery, because the surgery is in that area of the body, the pelvic area, the perineum, and there are nerves that would go to the genitalia, all in that area, and sometimes the surgery can cause some injuries to the nerves, and the injuries, it's just like when you have a cut, your skin, laceration, with time it tends to heal. So yes, in the immediate weeks following surgery, it is not unusual for people to report that. So what I would say is that he needs to come in. We need to investigate why he has erectile dysfunction after that. But it is not automatic that there's so many people in their 50s who've had prostate surgery, and Kwame, it's AK-47 all over again.
All right, interesting. Kwesi from Kumasi sends a message, and he says, look, my woman can last more than 20 minutes without the big O.
Okay.
Orgasm, of course. Because at times she tells me she's enjoying the act and she doesn't want to orgasm. Now, this is Kofi sending this. Then I get another message here, and they're quite interrelated. That's why I'm putting them together. Doctor, I'm 53 years and I have good erection.
Okay.
But my wife is someone whose libido is far, and she doesn't like foreplay. So when we are getting intimate, I ejaculate early. So what do I do?
Right. So both these messages are a reflection of some incompatibility all right, it's really not a big problem. It's incompatibility, and these are the individuals who benefit a lot from sex therapy sessions. They need to understand what that whole game is about. I think most of the time, the mind is that everybody goes in with a selfish orientation. I feel this way, I want something, you're going to give it to me. It's never about, okay, I'm going to make you happy, and then hopefully you also make me happy. But it takes two to tango. This is one of those things that it takes two to tango. So again, as part of our approaches to managing PME, ED, the sex therapy sessions are absolutely important. The challenge that most of the time we have, Kwame, is that the couple don't want to come together. This one will come, and then this one will come. They think they can learn something separately and go and solve the problem quietly. But we would strongly encourage couple counseling when it comes to that. So it's just some incompatibility, and then everybody needs to understand what the sexual response cycle, phase 1, phase 2, phase 3, phase 4, what it actually means for men and what it means for women. And then everybody's got to sort of like move to the middle. I think most of the time the problem is with the men.
Yeah, ding.
It's difficult for men to understand how a woman's body operates and how a woman's mind also works with these things. So for the men, it's just straight to Jerusalem and then we're done. I mean, when we are going to maybe have to pass through Gaza and all of that, you have to make sure that you see things on the way. You say hello to them, you try some pattern to Kakra, and then on your way. You don't just leave Ghana straight to Jerusalem. So through these counseling sessions, we are able to then teach people about the normal physiology, the normal way the body functions when it comes to this. It's usually not medication. It's usually these therapy sessions that we have with them. And if they are open-minded, then it really, really works well.
Mahama sends a message. No, it's not the one you know.
Hey.
It's not the one you know.
Hey.
I can confidently say that.
Carry.
Doc, when I I know he listens to this show, but I am not sure he's the one. We can find out.
We shouldn't discount anything.
Maybe it's, well, the only way to find out is to say Eyezu. if he responds, So Muhammad says, Doctor, when I ejaculate, I feel some burning sensation in my urethral opening. What could be causing that?
Most likely he has an infection.
Oh.
Yes, we call that a urethritis or urethritis.
Okay.
There's inflammation of the tube that runs through the manhood that comes out. So that's the opening, the orifice.
Yeah.
The opening. And there's supposed to be no pain there. Either there's some injury that has happened there, but if there's no injury in that area, most likely it is some inflammation.
Well, Muhammad, the good thing is that Medicas has already started a 24-hour economy. So at any time of day,
pharmacy.
But it's part of the economy, Anna. I'm just saying that he can come to the hospital at any time.
I know can say.
And I make cano.
Then they say, oh, okay, all this too is possible.
It is possible. All right. Let's take our last call and we can wrap up here. Hello.
Hello.
Yes, sir.
Good evening, sir.
Good evening, sir. You're welcome.
I'm happy to talk to you and plus the doctor.
Yes. We're happy you are here.
During my elementary school time, I'm a high jumper.
Okay.
And one day I fall seriously, but I don't know that something has happened on me. Not my English, but I'll say it.
Oh.
What this happened to me is when I have a surgery on my leg, doctor told me that why I cannot stand correctly. So I told him that during my school time I'm a high jumper. Then according to the X-ray, they say my spinal cord has to open the waist. So always I can't stand correctly or I have to bend myself. I cannot straight up myself. So it's very painful for me for almost so many years. And secondly, to my ejaculation is poor. I can't do anything anymore. I don't feel it. So I want to ask the doctor, beg him to tell me what I'm supposed to do.
Uncle, how old are you, please?
I'm now 75 years.
Okay. All right. Thank you so much. We're grateful that you called.
Yeah.
What I heard was that he suffered an injury. He felt terribly, and then he suffered this injury, and he's had pain, chronic pain, for many years. I don't know where exactly the pain is, but it appears to be in his lower back or in the pelvic area. He cannot stand up straight, and this, in a way, may make a contribution, chronic pain, to your ability to have a satisfying sexual life. He needs to come in. He needs to get a thorough assessment by the orthopedic surgeon. We cannot do that assessment on radio, but he needs to have an orthopedic specialist see him and make a thorough assessment. Again, he's age 75. A lot of factors may be at play as to why he's having sexual dysfunction. It may even be connected to the injury he's had at his low back. So again, I'd mention it's a multidisciplinary facility. We've got 2 wonderful orthopedic surgeons we work with at Medical's Hospital. He should give us a ring and let us arrange something or have a much more extensive conversation online with him.
Okay. What's the number to call?
Right. So the number is 0501 477 340. 0501 477 340. We're on WhatsApp on this, so you send us a message on WhatsApp as well.
Dr. Osafo is the CEO of Medical's Hospital. Thank you, Doc.
You're welcome, Kwame.